Awesome. So, Alicia, could you please tell us what your personal journey's been with respect to your thyroid health and how you got into this field?
Yes, I would love to share about that. Let's see. I graduated college over 10 years ago as a registered dietitian and started in the field as a clinical dietitian and really enjoyed working in the hospital, fast paced, learning a lot, the inpatient population. And it was great for an initial first job. I was in the ICU, PCU. That was all well and good. About 2 years in, I knew that I wanted to change. I wanted to, do something more with the outpatient realm and work with my clients and patients for more than just one visit while they were in a hospital bed and sick. So I switched to an outpatient wellness center and I became the staff dietitian at that time. And this is when I started to realize a little bit more about my personal symptoms, my health. I was very eager to dive a little bit deeper and check on things more than like the standard lab work or the standard checkups that you get each year. So it was while I was at this wellness center with a new job, and I went in for an annual physical. And at the time, I thought I was the picture of health, dietitian, eating well, exercising, and I asked for additional blood work because I was just curious where things were at and how well I was doing. And so my doctor ordered like a little bit more in depth with the blood work, and to both of our shock and surprise, I had overt hypothyroidism and advanced Hashimoto's. And that was a real huge reality check for me. Like I said, I think I either dismissed or downplayed my own symptoms, and or my body got really good at compensating and adapting to not having the essential hormones that it needed. So for reference, for anyone who is familiar with thyroid labs and ranges, my TSH, which is a pituitary hormone that signals to the thyroid to create thyroid hormones, when it goes high, it's low thyroid function, and when it goes low, it's overactive thyroid function. So it's an inverse relationship. Normal range for TSH is anywhere from like zero point 0.5 to 2, roughly, is like optimal. And mine was at 42.6. So I was, meaning this was also a good reflection that the condition has been going on for years. And it had certainly fluctuated. It wasn't always so obvious for me. My thyroid antibodies were in the thousands. My T4, T3 levels, like the actual thyroid hormones, were at the bottom end of the range. And I remember my primary doctor just looking at me and saying, "How are you getting out of bed? Like, how are you even functioning the way you are?" And I was like, "I don't know. This is just as a shock to me as it is to you." And I think I had normalized a lot of what I had been feeling in my 20s and throughout college as working multiple jobs, going through a dietetics program, trying to have a social life and an internship and all of this, and didn't realize the warning signs and the red flags about my own health. I think until I had that blood work just so obviously telling me something was very, very wrong, and needing to take a step back and look at my own health as far as how did I get here. So that was a big moment for my health, for my career, because it was from that moment that I became the patient. And I went through the whole process in the conventional medical system of seeing an endocrinologist and being referred to a specialist. And I remember bringing a long list of questions that I had researched and learned about, even with my own job at the wellness center, of, you know, dietary changes, supplements, medication options, all of these things, because I was very curious. And I remember being completely shut down by the doctor, by the endocrinologist, saying, "You don't need to worry about your diet. You don't need to make any changes. All we need to do is replace your thyroid hormones and you'll be good to go." And it was, I mean, I was very upset. It was very defeating, very discouraging. And I obviously didn't take that as an answer. That kind of propelled me to, one, research more of what I could do, because I knew there had to be more. Being a dietitian, being in the functional world, I knew there was more I could investigate. And two, this definitely opened my eyes to the population of thyroid patients. And I knew I wasn't the only one being like, having this really huge lack of guidance and education and support. So, my job at the wellness center, the owner decided to step away and sell the business, and this was right before around the time of the pandemic. So I decided to start my own practice, and I was like, if the naturopath who was working and owning the business can do it, she taught me a lot. I knew I could also do it, and then I also had this population that I was very passionate about serving, that I just wanted to help them. And there's no shortage of thyroid patients out there who need better help and better care and better education. So then, kind of in combination with the pandemic and how things changed, I went fully online and just specialized and learned as much as I could about thyroid health. And not only to help myself, of course, like I wanted to feel better and reverse my symptoms, and improve my health, but also for everyone out there who just found themselves in or have been in my position. So that's kind of the long and short of it.
Was it almost a sigh of relief, so to speak, that you were getting some actual answers to why you weren't feeling all that great? You were feeling a little bit sluggish and didn't have a ton of energy.
Yeah, I think, like I said, that one appointment where everything was kind of turned upside down for me, it did help me reframe and understand, oh, the level of fatigue that I would feel from time to time, or, well, it was maybe more than that, is not normal. This isn't just because you're busy. It's not just because you're a woman. It's not just because of stress. Like, your body can actually feel so much better when it's supported properly. And so, yeah, in that way, it was very validating and encouraging to know that, okay, these symptoms aren't random, and it's not just because of how I am type of thing. It was something deeply imbalanced that needed, to be addressed appropriately. And thankfully, I'm sure we'll get into this. When I did, I mean, I feel so much better in my 30s than I did in my 20s. And I'm a mom now, and that demands a lot of energy too. So I am so grateful that even though we caught it late, like we discovered it late, I did figure out what was going on. And then I was able to really just support my body in the way it needed.
Uh, Based off of that, were you initially? It's funny. I always ask a lot of my like doctor friends. I'm like, how many patients come in quoting, Doctor Google or Doctor AI? As a registered dietitian and really a scientist yourself, were you one of those people who is taking a very objective look at your symptoms and saying, okay, like let's not freak out. This is what it could be. Or were you like kind of on the other side of like the patient spectrum and maybe getting a little bit nervous? Like, so basically, were you like a good scientist? Were you a good patient like initially?
Oh gosh, yeah, that's a tricky question because when I was initially diagnosed, I was just getting into, and this was like around 8 years ago, I was just getting into the realm of functional medicine and just understanding what that meant. And I never really had routine blood work up until then. So I think I was pretty disconnected from my body and from what was going on, that I genuinely at times, like, I felt bad, but I didn't think anything was wrong. And I didn't think to take that next step and investigate. So it really wasn't until that appointment that everything came together, and it changed how I viewed my health forever. Now I would say I'm a great scientist and a patient because I'm just hyper aware, and I understand what's going on so much better now. But yeah, initially it really kind of rocked my world with, I felt blindsided. I know that's not always the case. Like a lot of times, especially with the patients I work with and the clients, they've been searching for years and years and years for an answer, and then they get it and they feel, hope and relief that they can, run with that diagnosis and treat it. But no, mine was kind of the opposite. It's like, I was hit with that diagnosis, and it was really scary. I didn't know much about autoimmunity, and there was some other things with my blood work that looked even more serious. Thankfully it wasn't, but yeah, definitely a little bit of a health crisis there, and maybe even like an identity crisis, like, oh, I'm not as healthy as I thought, and I wasn't as in tune with my body as I thought. But I think I needed that. Otherwise, I don't think I would be where I'm at today, or feeling as well or be as healthy as I am now if it weren't for that.
And it's interesting because as as yourself being a registered dietitian, when I was in grad school, my whole lab, it was very nutrition based, and
Mm.
I was the only one who didn't have an RD. And
Okay.
they were always like telling me like, what to eat, and I should have a little bit more of this and a little bit less of that. And I always looked to them for knowledge and inspiration, saying like, oh, like, you have the real world knowledge, the clinical knowledge
Mm-hmm.
of really the macronutrients, the micronutrients. And I'm looking at you as someone who has that knowledge. Were there any huge or even subtle shifts in your diet that you found worked for you before we get on into like, how those folks with Hashimoto's can deal with things? Like how did that look for you? What moved the needle the most?
Yeah. Oh, I love that question. I think it's important to say that because I hear this a lot from thyroid patients and women where they tell me I'm eating clean, I'm eating gluten free, I'm cut out dairy. Why am I not getting better? Is speaking with nutrition, just solely on that. And that is not the same. What I just described is not the same as eating for hormone optimization, eating for metabolic health, eating for energy. And I think that's a lot of what I do with my clients is educate them. Like, you do need to learn nutrition. It's not just about what you cut out. It's about what you add in and how you personalize it to your needs, to your goals, to your physiology, all of that. So for me, absolutely. I know for a fact I was under eating for, oh my gosh, years. And I didn't really understand that to be energized and lean and build muscle and healthy, like I actually had to eat way more than I was used to eating. And that was scary. It was scary for me, especially growing up in the time of, being a millennial and growing up with like, beach body and like the way the fitness industry was and like how diet culture was and for women in general, like there's a lot of pressure there. So trying to really break out of that mindset and be comfortable and accepting of, yeah, I'm going to have to eat more. The scale may go up, but this is the only way out of this vicious cycle of hurting my thyroid function and, you know, not having energy and, having poor body composition, all of that. So eating more was the biggest. Because I tried everything, vegan, vegetarian, keto. I mean, you name it, I probably did it for a time frame. And that was not the answer. I wasn't really eating for health. I was eating for what everyone else said to do. It was always framed as this is a quick fix. You'll feel better in 30 days type of thing. Yeah, even as a dietitian, I got hung up in under fueling, and that's a really common mistake that a lot of women, intentionally or not, a lot of times it's not intentional because again there's a lack of education about nutrition, about calories, about macros, and how to customize that for your goals. So yeah, that's definitely the biggest one, and I preach that a lot now.
And with Hashimoto's disease specifically, or maybe it's just hypothyroidism,
Mhm.
is it considerably more common in women than in men?
Yes, absolutely. So for women, it's about 5 to 8 times more likely compared to men. And a couple of reasons. One, the most common cause for hypothyroidism or low thyroid hormones in the body in developed countries, so where iodine deficiency is not a concern, is autoimmune thyroid disease, Hashimoto's. So, because of that, then you go to the question, okay, well, why are women so much more likely to develop autoimmunity compared to men? Because that is also true across the board. Not for all autoimmune conditions, but for most of them. And the reason for that is it's, multiple things. It's multifactorial, and it's the theory of our hormonal profile is very different to, compared to men. Of course, we go through significant hormonal changes throughout our life, from puberty to pregnancy, postpartum, perimenopause, menopause. So those are very key times that Hashimoto's can develop, and the way that our hormonal profile influences the immune system. And then you have other factors that can apply to both men and women, where it's, your environmental stressors, your genetics, the, status of your gut, and so all these other factors that usually are present, but they can also be different person to person as well. So yes, much more common in women for the reasons that, yeah, I just went over.
And it looks like, so you said that women are 5 to 8 times more likely to get it from men. And there's a lot of epigenetic factors. There are some genetic factors, and there's also some nutrigenomic factors.
Mm-hmm.
And really, is there an underlying mechanism of maybe inflammation and oxidative damage, which can then bring upon that? Because what you had said was like a key component of like, I wasn't eating enough, I was under fueling.
Mm-hmm.
And what's interesting is like looking at the lens of maybe, I don't know, like exercise science, you might think
Mm-hmm.
about like the female athlete triad. You might
Yeah.
think about like losing your period. You might think about bone mineral loss of bone mineral
Mm-hmm.
density, maybe even some sarcopenia, maybe some, you know, cognitive fatigue or depression risk. But from this standpoint, I had no idea that low thyroid health could be correlated with decreases in I guess energy uptake over the years. Like that is enough of a stressor.
Yeah, I think it's definitely a piece of the puzzle. I don't think, I mean, for example, if someone did not have Hashimoto's, like that was not the driving factor for their low thyroid function and they chronically underate, I do think there might be a mild to moderate impact or hit to the thyroid function. Mainly through adaptation, through metabolic adaptation. Your body is always looking to survive. It's looking to restore homeostasis and be in that state. And when you under fuel for years and years and years and you're lacking micronutrients and just basic energy needs, like your body will adapt, your metabolic rate will drop, your T3 levels will drop, reverse T3 often goes up. So, but that's reversible. That's something that you can definitely dig yourself out of. But thyroid hormones also don't work in isolation. They affect other systems in the body too. So it's the mammalian metabolism is very complex, so yes, that can absolutely impact thyroid function. But as far as like the development of autoimmunity, I don't believe it's just one thing. I wish it were. I think it'd be way more simple and easier for people to maybe grasp and understand, like, oh, it's just this one thing. I just got to address that. No, it's normally like a multitude of things, from, like you said, like genetics and environmental stressors. And but yeah, I mean, having nutrient deficiencies certainly don't help, and putting your body under stress year after year certainly is not going to help the situation, and can maybe exacerbate the autoimmune activity potentially.
I even wonder because again, it's like it just seemed like a perfect thing. Because when I was like coming across your profile, I was thinking like, okay, like which came first, the
Mm.
dietetics interest or like the thyroid interest? And what you said, like you were in school being a registered dietitian, doing all your rounds and everything, and like then the thyroid issues came into play. And I almost wonder too, because there's a lot of people, potentially shift workers, who need to work night shifts or alternating day shifts, night shifts or 24-hour shifts. And even like military people in the military, their thyroid function usually gets decreased over the years, and that's just due to like chronic stress. And I'm wondering,
Absolutely.
like, do you think that, or maybe do you know if hypothyroidism is a lot more common than hyperthyroidism coming from
Mm.
years of stress?
Yeah, great question. So, yeah, Hashimoto's is more prevalent than autoimmune Graves' disease, which is the main condition that drives hyperthyroidism. So, usually the treatment for that is pretty definitive. It's medication to kill the thyroid gland, or removal of the thyroid gland, or radiation. My grandma actually had Graves' disease, so again, it runs in the family. Why that is less common, I'm not sure. I know there's different sites that the immune system targets for Hashimoto's compared to Graves'. So one will drive up thyroid hormone production, one will drive it down. But the populations you described, which are a lot of the time the populations I work with athletes, I've worked with military, I've worked with, high stress. And I also like to think that, past and current trauma, as well as personality and temperament, it all plays a role. You can't disconnect the body from the mind, the nervous system, your emotional and mental experiences, and all of that. And I tend to work with higher functioning professionals, working moms. It's no coincidence to me anyways that this population tend to develop autoimmune thyroid disease maybe more. That's just my observation. But I do know there's a strong link between whether it's childhood neglect, stress, trauma, whatever you want to label it, and especially with women in the development of autoimmunity over time. But yeah, as far as why hyperthyroidism is less common, I don't know. I believe it has to do with where the immune system targets the thyroid gland, and if it's going to cause Graves versus Hashimoto's, and a genetic factor as well.
It almost seems like one of those unfortunate double-edged swords, that the type A person who has like a nonstop yearning to drive forwards, it becomes a positive feedback loop, that because you're maybe so cognitively stressed and even just physically stressed, because you're working so hard and you think, hey, like once I'm done this project or this goal, or I get this degree, or I
Mhm.
have this family, I make this much money. And maybe during that period of time, you're like, potentially the stress hormones are so high and they're keeping you almost like
Yeah.
caffeinated in a way. And on the
Yep.
back end of that, it's almost like a student coming off of their finals. They get hit with the flu or they get hit with
Yes.
something.
Yeah.
They go,
You go on
wow.
vacation, you get sick.
Yeah,
Yeah.
exactly. And it's like,
Yeah.
I know I felt that like that sort of burnout at the end of grad school for me, where like for about a year and a half, I kind of had like mild PTSD symptoms and was waking up screaming and hyperventilating and sweating. And it was like, okay, I had to get it out of my system. And
Yeah.
thankfully I didn't have any thyroid issues, but
Yeah.
that's almost what I'm seeing here, is that these very highly motivated type A people drive so far. And at the end of that road is like, ooh, now you may have some sort of autoimmune issue, some sort of thyroid
Yeah.
issue.
Yeah. Yeah, I 100% agree because that's me. That's absolutely me. And I so my husband is a mental health therapist and he specializes in behavioral psychology, personality. So I've learned a lot through his studies and his research and what he specializes in. And if you are familiar with psychology, it was actually my minor. So I remembered like 1% from what I learned in college. But the big five personality aspect, the acronym is OCEAN. So openness, conscientiousness, extroversion, agreeableness, and neuroticism. And everyone, falls on a spectrum for these different traits. And what I have come to find is, yes, like you said, type A, those individuals are very high in conscientiousness. They're industrious, and they're orderly, and that really drives them, and it's kind of like this grit that people describe sometimes that we don't even know where it comes from, which is fascinating. And coupled with that, and this is more common with women, two aspects is being really high in agreeableness. So we say yes more. We put our needs last more. We say yes when we actually probably mean no. So there's this, incongruency with what we say in our intentions and what we actually feel is probably right for us. So that can be a problem in a lot of clients I work with. They have a hard time putting their health first or putting themselves first. And some of that's biology, like women are meant to care for children and care for family and be very nurturing. But like you said, double-edged sword, it can kind of come back and harm their own health if it's not balanced. And then the other aspect is neuroticism, which women tend to be higher in. And neuroticism basically meaning your sensitivity to negative emotions. So women are more sensitive, again, biology, how our brains are wired, because we are constantly scanning the environment to protect our kids and protect our family and make sure everyone is safe. So when women tend to fall with higher agreeableness and higher neuroticism, and then you get those type A with the high conscientiousness, it can be that perfect storm if we're speaking strictly temperament, your nervous system, that type of thing. Perfect storm for driving yourself into the ground. And I only say that from personal experience. So yeah, it's very interesting when you start looking, the body keeps a score. When you start looking beyond diet and exercise and you're open enough to understand that it is more than that, I think that can also be the key to getting the right type of help too.
I love that idea. I had never heard the acronym OCEAN before to
Really?
describe those traits. I remember like
Yeah.
taking was it the Myers-Briggs test?
Yeah, that's a different personality test, but yeah, it's similar. Hmm.
I think I'm like ENTJ, and a
Yes.
bunch of my friends are the exact same thing, or they're INTJ, and I'm like, okay, like, is this good or bad? Do I hang out with you?
Right. Who do I attract? Yeah.
Like, should I not? One of my
Yeah.
buddies was on a first date, and the girl just slid across her phone, and she goes, "Can you please take this?" And he was like,
That's so
"Yep, let's do it,"
funny.
because he was highly agreeable.
Yeah.
And she was like, "I
Yeah.
don't know if we're compatible or not."
Compatible. My husband, so this is a story he loves to share. So when we were dating, he had me take the big five aspects personality test. And I love that stuff anyways. I'm like, absolutely. I would love to see what my scores are. And he wanted to see, little did I know, he was like seeing how compatible we were. And I mean, he told me, he was upfront about it, and we're very compatible. And that definitely has been great for our marriage and our partnership and all of that. But yeah, it does make a big deal. I mean, it does really help to understand your personality for your own health, I would say, but also how you navigate the world, but also, of course, like relationships, that's a huge thing. So yeah, it's very real, like who you attract. I tend to attract a certain type of clientele for sure. They tend to be similar to me. And I think that's a great thing because I know how to help them. you know?
So based off of that, it's funny because one thing that came into my mind, and you put it very articulately, that women are typically a lot more conscientious and a bit more neurotic, and they're more orderly,
Hmm.
typically than men are. And it's funny because I'm seeing my parents now who are in their young 60s or early 60s, and my dad is becoming more like my dad, and my mom's becoming more like my mom. So they're just like, I don't know, bolded, underlined, and all caps versions of themselves from 30 years ago when they were raising my brother and I. And my dad's a little bit more like relaxed, doesn't really
Hmm.
care, like he drives even slower. And my mom is just even more pent up, like with 10,000 things that really don't matter. So, what you're with like the avatar that you see, what are
Hmm.
some initial steps that you help a lot of your clients with the
Hmm.
personality aspect, and then we can kind of go on into the
Yeah.
functional medicine, then the
Yeah.
nutrition, because I'm interested in like these little steps that you take. So with respect to personality and these everyday actions, how do you go about that?
Yeah, absolutely. I mean, I think that's another reason why it is really helpful to understand temperament or have at least a general understanding, because then you know what areas they're going to struggle with. And you're absolutely right too with, it is hard to change, and what we understand of personality and temperament, you kind of come out the way you're going to be. I mean, that you were born the way you're going to be, and when you start having kids, you realize that really fast. Like our two kids are not even close to having similar personalities at all, and our daughter, I don't even know where she came from. I'm like, you are not like my husband. You are not like me. So really, really interesting. But yeah, you can also see it, like you said, maybe with your parents or older generations, like they kind of become more of who they already were. And certain situations can exacerbate that. And there are some things that can actually change that too, like maybe negative, like trauma or something like that. But understanding it from an aspect of like coaching and counseling, which is part of being a dietitian and working with clients, the biggest thing for the clientele that I see they usually need support with, and again, this was something I struggled with deeply, was the black and white mindset, the all or nothing, because they are so stuck there that if they can't do it perfectly, it's not worth the effort, or you're going to start over. And a lot of that is breaking down their beliefs, their help them unlearn these behaviors, which is hard. Don't get me wrong, this is not something we do overnight, but just understanding that, I like to use phrases like, let's look for the lowest hanging fruit possible. And if we're going to do 5 minutes of walking, or we're going to change one thing about your nutrition, and that's all we can do, that is great. That's a small step in the right direction. Kind of the whole atomic habits mindset, I
Literally just
think.
wrote down it. I'm
Yeah,
taking notes, and
yeah,
I wrote down
yeah.
atomic habits right on here. I was like, oh, we got to talk about this.
That's it. Yeah, yeah. If you can, that's very useful. It's very practical, and I think it lends really, really well to people who are stuck in that mindset of all or nothing, and they can't see that it's a spectrum, and it's very gray, and we live in the gray, and it's just about being that whole like 1% better than you were, and getting that kind of positive momentum going. And that can definitely take a lot of time. And then also, we work a lot on, well, how can we remove or reduce barriers or obstacles to make your life easier and to make the change easier? Because change is hard. And if we can make it just a little bit easier so it doesn't feel so overwhelming, because the clients I work with, they are already overwhelmed. Their plates are already full. They need the easiest way forward that is also effective. So that is kind of where we start a lot of the time. And I mean, I do work with clients who are not type A too, and that's like a different, different approach for sure. But most of them are, I would classify as more conscientious and more productive, but also more overwhelmed. So those are the areas I typically start with.
These I love the idea of breaking down that black and white mindset. And I think that, like, I mean, we've all like heard it with like social media that there's really phenomenal information and really not so phenomenal information. And we really need to be our own advocates and scientists to parse things out. With this shade of gray, with something like hypothyroidism, does that change even day to day, month to month, year to year in like some of the symptoms someone may have or some strategy they're taking? Could something work for a little bit of at the time and they need to shift it? Is that like an ever changing autoimmune issue?
So in the context of autoimmunity.
Yeah, because I'm curious
specifically?
because like there's
Yeah.
some things it's like, oh, like I enjoy waking up early. And I think like that's going to be
Mm,
solid throughout my entire life. But if you're dealing with something autoimmune, it's like, sometimes some things work. And then for a little bit of time, you have to wean off that and kind of get something
yeah.
else in there. So what's that kind of look like?
Yeah, that's a great question and kind of comes off what we were just talking about. Like, what do I typically start with or address with my clients? So, a lot of it is about, and you can apply this to almost any area of your life, but meeting your body where it's at. And it does change. It is seasonal. And I also work with moms. So, like, or women, who are either pregnant or trying to get pregnant or postpartum, huge changes, mentally, emotionally, and physically. So, learning how to meet your body where it's at is also a skill because a lot of people don't understand what that means or how to do it. They're like, what do you mean? Like, I need to work out less. What do I mean? What do you mean I need to recover more? And what does that look like? Or eat more, like we were talking about. So that's a big one, because that way you can be both aware and adaptable to what your body's telling you. And that's so important when it comes to living with an autoimmune condition. It's not just going to be the same ever. It is going to fluctuate. And that even is true if you are someone who is able to get into remission and the autoimmune condition is well managed and the inflammation's low, your immune system is more balanced, and your blood work is stable. All of that, you can come out of that. Something can trigger an illness, a trauma, stress, and you have to, one, be accepting of that, but two, understand that, okay, in those times when that happens, how do I meet my body where it's at? How do I care for my body through a flare? Or if you're postpartum, that too can also trigger autoimmunity or trigger Hashimoto's, postpartum thyroiditis. So it's when you get into that mindset, I think it's really helpful because again, it's a skill and you're going to want to know how to adapt to the different changes that you're going through because life is never the same, right? It's like life is going to happen. Life is going to life. So, yes, in short, to answer your question, things do change and they do fluctuate. And a lot of it is dependent on your immune system and, the stability of it. But even as much as you can have within your control, there's still so much out of your control. And you just got to have to, be accepting of that and understand that, change can happen at any time.
What is the flares and then the remissions look like? I'm imagining kind of like a sine wave of you're in
Mm.
kind of like a peak and a valley. How long does that typically last? Can you reduce, so to speak, the amplitude of the waves? What does that look like?
Yeah, it's different for everyone. The way I like to describe a flare, simply put, like an autoimmune flare, is a flare of symptoms. So an uptick or an increase of symptoms, and that can be specific to you. But the most common ones I hear and I've personally experienced is when inflammation goes up, right? So think of chronic inflammation or when you get sick or have the flu, achy, fatigue, brain fog, maybe digestive upset, that type of thing. You just feel not well. And for some people, it is significant. It can, last weeks to potentially months, especially if maybe they're a person they may have more than one autoimmune condition, or maybe one of their autoimmune conditions is more severe, maybe something like IBD, or, something that it really can impact their quality of life so much. So it can last a long time. Yes, I do believe there are ways to shorten it and maybe prevent it potentially. That's not always a guarantee, but understanding your personal triggers and stressors is really important. So just that awareness of, when I overload my schedule and get really stressed out, I tend to send myself into a flare. Or if I don't get enough sleep, I am more susceptible or vulnerable to going into a flare, meaning you're not supporting immune system balance very well. So, having a really strong foundation is number one. Your daily habits need to support your body with autoimmunity and strengthen your immune balance and just set yourself up for success, basically. And if you're living a chaotic life, you can expect chaos from your immune system. It's just trying to react to the signals you're sending it, essentially, or the things you're allowing to happen. So if you can provide that structure and that internal harmony as much as you can within your control, ideally, this doesn't always happen, but the frequency of the flares and maybe the duration and intensity can be less. And that is the goal. That is the goal as far as like autoimmune management. It's like your nutrition is your sleep recovery, your stress management, movement, all of the factors. So you're not constantly someone who's just succumbing to the autoimmune activity and the autoimmune disease.
This might be, I don't know, this might be a stupid question. And I apologize if it is.
That's probably
Um,
not.
so, like with, for example, type 2 diabetes,
Hmm.
people can obviously become type 2 diabetic with, inactivity, poor diet, insert any other predisposing life factor that is relatively controllable. And then it could become essentially untype 2 diabetic or more insulin sensitive, right?
Hmm.
With like healthier diet, putting on muscle mass, exercising, yada, yada, yada. Is that the same thing too? Can that be done with something like hypothyroidism, where you're saying how you can get into a longer remission and decrease the intensity and the length of the flares? Can you completely obliterate hypothyroidism if you have it, or just really reduce it so that it's like a quiet little whisper as opposed to a shout?
Yeah. So when you say hypothyroidism, do you mean Hashimoto's? Because they are different. So are you talking about more specifically like the autoimmune
Yes.
aspect? Yeah, absolutely. And I see that. I mean, I've done that with my own journey where the symptoms and the severity were significant, at the beginning, and you know now they're almost non-existent because I have addressed my underlying triggers and causes that got me to this point. But I've also established habits that keep me healthy and honor my body, honor my physiology, honor my hormones, all of that. So yeah, definitely, and again, every case is different, but overall it's never going to hurt to understand your body and live in a way that keeps it healthy.
No, that's awesome. How much is for you as like the coach, how much of what you do initially, maybe within the first month or 2 months or 3 months, how much of it is actual buy-in from the clients of like them trusting you, of you working with them, meeting them where their body is, of like they might have these firmly held beliefs of what a meal is. A meal
Mm-hmm.
might include a huge source of simple carbohydrates, or maybe staying up late and watching TV is normal for them, or having a couple sodas with dinner might be a normal thing for them, and you want to kind of you know shift the table a little bit so the return on investment is big. How much of that is buy-in on your part?
Yeah, honestly, I don't think much. And the reason being is because by the time people get to me or, jump on a call or are interested in working with me or they follow me on social media, whatever it be, they're already past that point as far as like transforming their lifestyle to what they know to do, basically. A lot of the people I work with are already eating pretty well. They're active. Maybe they're taking supplements. They're getting routine blood work. But then they kind of hit this wall or this plateau where they're like, okay, beyond this, I don't know what to do next. So that's usually where I come in. So, I mean, there's always going to be a decent part of it is going to be, like I said earlier, unlearning bad behaviors or poor behaviors, maybe I should say, and being a little more open minded about the approach and what changes are actually going to move the needle versus not. So, yeah, definitely that's every time I meet with someone, we're kind of reinforcing like the better habits we're trying to build. And usually the payoff is pretty quick and easy for them to get on board because they're starting to feel better. They're like, this must be working because, and we look at metrics other than weight too, because I know that's a big one. That's a big outcome a lot of thyroid patients are trying to achieve is they simply want to see the scale go down. However, a lot of the time, with my approach, anyways, that outcome is way later because we're setting the foundation for the body to even be in a position to drop fat, to lose fat safely and effectively and sustainably, and all of that. So I tell them, how's your energy? How's your libido? How are you feeling warmer with your hands and your feet? How's your digestive motility? All of these things are like, oh my gosh, yes, these are all getting better. I'm like, that those are usually the first changes you're going to see, not, oh, the scale went down by 5 pounds. Like, no, that's going to come later. And it should if you're doing it right, honestly. Especially with the clientele that I work with, and they may have a history of just like not eating enough and like overtraining. Like there's a lot of pre-work we need to do to set that foundation before we get to um the shifts with body composition. So yeah, the clientele are pretty warm and ready when they come to me, as far as like they're already seeking a more comprehensive and a more root cause approach anyway. So they're kind of like, tell me what to do and educate me, and I'm here for it.
What other subjective and objective measures do you look at? So you have like body composition. Do you also look at blood work? You said like the day to day, gastric motility and energy and like the sensitivity of hands and feet. What are some things that you really like to look at?
Yeah, I do blood work. I love data points. I like to see what's going on, and usually symptom improvement is a pretty good thing to like subjective measure to track. 'Cause that almost always coincides with improved blood work, depending on what you're looking at. So blood work we do routinely, and then yeah, I have these forms that I send out monthly to all my clients to track, signs of inflammation. So like water retention and joint pain and stiffness, and then energy and like how do you feel when you wake up in the morning? Other things too that people might note is like their skin health or their hair health. So that can take a hit from low thyroid hormones or inflammation. And maybe they have like a skin condition going on, like eczema or psoriasis, and they're like, oh, I haven't had a flare of that, or it's improving. So, or my acne is improving. So any area that we can kind of look at head to toe, because thyroid hormones affect the whole body. Every cell contains thyroid hormone cell receptors, so they are important. So that's why, cognitively too, that's another one I should mention, brain fog, anxiety, memory, recall issues, depression, apathy, those all too are directly linked or can be to thyroid dysfunction, let alone systemic inflammation from Hashimoto. So all of these areas we look at, and usually people are going to be more aware to their specific pain points. So if they're really struggling with fatigue, if that's the first thing to improve, they're going to be very aware, like, oh my gosh, I didn't have to take a nap today. That's a huge win. So
That's great. When you were saying that, skin and hair health, I'm thinking about some of the essential like fat soluble vitamins. I'm thinking about vitamin A,
mm-hmm.
I'm thinking about vitamin E. When you're talking about cognition, I'm thinking about like omega-3 fatty acids. From the registered dietitian in you, what are some really awesome nutrient dense foods and dietary patterns that people can start to um, take a hold of, and some more calorie dense foods which maybe they could kind of pull out a little bit on?
Yeah, I will say first before I answer that question, um, because I see it a lot with my clients, it's not just what you're eating, it's what you can digest and absorb. And that's another area that takes a pretty heavy hit for thyroid patients is weaker digestion, so lower stomach acidity oftentimes. They might be dealing with like SIBO, which can impede nutrient absorption, constipation, motility issues. They may also struggle with bile flow because thyroid hormones help with like the contraction of the gallbladder. So all these areas that influence digestive function are impacted by thyroid status and thyroid health. So I do address that with my clients, is like really looking at digestive health and capacity and gut health overall, because it doesn't matter how clean or great your diet is if you are not absorbing nutrients well. That can be a huge problem. So that being said, I'm a big fan of animal-based proteins and a big variety. I mean, I do definitely promote like cold water fatty fish is very nutrient dense, and like organ meat if you're open to it. And there's tricks. There are tricks to making these things more palatable because they're not as common, here in the US for sure. But there's even brands that my family and I that will get that I think it's called Vital Farms, if I'm remembering the name, where they incorporate, there's like ancestral blends of meat where they incorporate in the meat, organ meat. So it's already ground in. You don't really notice it. That's how I do it. So much more dense in, different minerals, zinc and copper and iron and vitamin A and those type of nutrients. So that, and highly bioavailable too. Your body doesn't have to assimilate anything. It's not missing anything. All the amino acids are there. So really big fan of that if you can tolerate it. I have very few clients who can't tolerate meat. I mean, I've had one or two here and it's to no fault of their own. So we do have to kind of be creative with the quality of the protein and making sure they're getting enough from other sources. If they can tolerate, all animal sources, if they can tolerate eggs, I'm a huge fan of eggs. If they can tolerate dairy, like whole fat, organic dairy, please eat it. Like these are very low hanging fruit when it comes to like nutrient density, and pretty easy to digest, especially with like the meat too, compared to maybe plant proteins. Some people have issues digesting like beans and legumes and lentils and things like that. So we have to resort to what they can digest. I'm a huge fan of when it comes to like complex carbohydrates and easy energy, I really like the berries, vegetables, squashes, especially coming into like fall and winter, eating seasonally. So if I'm like addicted to, I love like kabocha squash and butternut squash and sweet potatoes and purple sweet potatoes. Like aim for color and variety too, because you're going to get different types of polyphenols and phytonutrients and different types of fiber for your gut. Um, Helps with like preventing palate fatigue too, or getting burnt out on like chicken and broccoli. Like be creative with your meals as much as you can, but variety is a big one. So those are great because they, rice too, and depending oats and quinoa, like those types of gluten-free grains, depending on how well you digest them, but those can be great sources. Like we do need carbohydrates. It's just the form that they're packaged in, how well you can digest them. And then everyone has a different carb level that makes them feel their best. And especially too if they're more of like an athlete or something. I could go on and on, so stop me if you got your answer.
This is great. No, I really enjoy this. And I was taking notes on some things, and it was funny because one thing that I think that a lot of folks don't, I guess, understand, and I'm not going to pretend to be an expert on hypothyroidism by any means. And it's funny because people can throw out words like nutrient density, bioavailability, animal proteins, complex carbohydrates, eating seasonally, and that's phenomenal. That should be done basically for everyone. But
Mhm.
one thing that I was curious about is, does it really differ person to person on fiber content? Even because you had said like sometimes legumes, sometimes lentils don't really sit with people all that well. My mom is an example. I know this is like a little bit
Mhm.
off the topic, but like she was a colon cancer survivor. So as much as I would love to have her eating fruits and vegetables, she has to limit her fiber intake. And for
Mhm.
someone who has an underactive thyroid, you know, their gastric motility might be down or like a less than someone who
Mhm.
doesn't. Is fiber content typically different, or does even soluble versus insoluble fiber, that's a different conversation to have?
Yeah. Yeah, I would say it differs. I mean, you don't I think it can fall into this category like more is not always better if you're not being intentional about it. Like it's not just about like, oh, let me take a cup of psyllium husk every day because more fiber is better. It's like that's extreme. So yeah, depending on your microbiome and your digestive capacity and what you tend to tolerate, which definitely differs person to person, you may have to go through a process of learning that and understanding what is a sweet spot for you for adequate fiber. I do like most of my clients to aim for like 30 grams or higher from a variety of insoluble and soluble. So insoluble is going to be a little bit harder to digest a lot of the time. That's the, it doesn't like get gelatinous or anything. And it if you think of like cruciferous vegetables, like some people just do not do well with that family of vegetables. So it might come down to not eating them raw and cooking them down really well, or focusing more on soluble fiber that's maybe a little more gentle, and even just working up the amount that you're having over time slowly and having your microbiome adjust, because it will, and you can feed and diversify your microbiome simply through a wide variety of prebiotic fibers that you're incorporating or rotating through. So yeah, it really is. I've had some people eat a lot of fiber because they're more plant-based and they're kind of used to that, and then some people who are not, so we have to kind of titrate them based on bloating or how well they're digesting, or their bowel regularity or whatever it is. And but the body is really adaptable, which is the good news. Like and if you're creative, you can figure out ways to make fiber easy to get in and easy to digest.
One thing that was swimming around in my head for the past like few minutes that I really like that you had brought up, and I had a conversation with a physical therapist a couple weeks ago, and they said they specialize with dealing with people who have chronic pain.
Mm,
And not only can that be incredibly debilitating, but in order to rehab from whatever pain or injury that they might be dealing with, like there also has to be this parasympathetic drive, reduction in stress, and like this belief system that like it's okay, we can relax, we're going to get this pain away. That's already going to drive down some inflammation as it is. And then when you start incorporating the exercise and the stretching and the rehab and the massage therapy, whatever else you go along with it, that's just going to be the icing on the cake. And I really like what you said too about how like the first thing is like personality and setting up your atomic habits, setting up your space so that like the easy habits are easy and the bad habits are hard to do. And it just seems like if people can really reduce that low level baseline of stress, that when you do hit traffic or the check engine light does come on, or you get that call up, there's been an accident, like it might not be as bad. So it might be a 2 out of 10 bad as opposed to a 12 out of 10 bad. And I kind of wanted to like dig into that a little bit more. I think that
Yeah.
was really, really helpful. And you'd said that you had done that a lot in your life as well.
Yeah, absolutely. Something that I tell a lot of my clients too, because there's a good handful of them that are like, I have my job is stressful. My job is stressful and my home life is stressful, or I'm going through a stressful period right now. So I usually start with, okay, well, I can't take your stress away. I wish I could, but we can't. We can't just remove the stress that you are going through right now. However, what we can do is we can work on optimizing your internal environment, providing structure and harmony internally. So, like you said, dealing with the external stressors that will come and do come is easier. You can weather the storm a bit better. So even just telling my clients that, you can kind of see them like have some relief of like, oh yes, like there is a lot of control I have over my habits and how I support my health. And by doing so, I can become more resilient in time. And that is the goal. Like resiliency should be everyone's goal when it comes to how you age and longevity and everything, honestly. So if we can have a mindset of developing resiliency, that can shift a lot when it comes to stress. And I just had this conversation yesterday with a client because we were talking about even just your morning routine. And I know that's like a popular term right now, like your morning routine. But honestly, like how you start your day, that includes, your habits and what you do, what you think, what you eat, first thing, all of that, how you hydrate. And she was saying that, for her, if she gets up before her kids do and she has time for herself to get ready with being unbothered, peaceful, 10 minutes, 20 minutes, however long it is, and can kind of set the home for the start of the day for her kids to go to school, whatever, her day is so much better. Her nervous system starts off the day in a regulated, more calm state. So even something as simple as that, and that is absolutely something I live and die by, is like I do need to have that time for myself in the morning to make sure I'm showing up the best I can for my family and I feel resilient for the day. Like what is going to make you feel resilient for the day? Ask yourself that question, and it might just be I need to wake up and go for a walk, or I need to do my workout first, or I need to eat a meal that has some protein in it so my blood sugar is stable and I feel stable. So that too can just be a very simple, effective thing that habit that you work on building that can truly change your life. Like I know that's a big thing to say, but it's changed mine, especially for the people out there who they're parents and they're working and like every minute honestly is allocated to something. That's how it feels sometimes. It's like I don't, it's not till 9 p.m. that I have a moment for myself. If that's you, then you're going to have to build in these non-negotiable routines or whatever that looks like for you to kind of anchor your day, anchor your nervous system, and that way you're not constantly like reacting and operating on chaos and being dysregulated. That is not a fun place to be. It sucks. It feels terrible. So if you can avoid getting into that, being stuck in that loop, then you'll be doing great and you'll be feeling much better.
I think that's that idea of building up this like internal fortress of resiliency is probably like the best piece of advice. Because like I had this I think it was like a New Year's resolution for myself, and it was very simply, I want to walk slower this year. It was like wherever I go, whether I'm taking a walk
Yeah.
or whether I'm walking in my job or I'm walking to go see someone or like wherever it is, I want to slowly enjoy each and every step. And it's like, yeah, sometimes I have to show up 15 or 20 minutes early and like downrating the nervous system and saying, hey, I'm not in a rush because I'm going to show up 15 minutes early is like huge in like
Mm-hmm.
allowing me to be more present for conversations. And even when I'm at the gym and I'm like exercising, that's something we didn't talk about yet was exercise,
Yeah.
is I'm not in a rush because I'm like, hey, like I allocated 2 hours, but I only need one. It's okay. I can
There you
wait for the
go.
treadmill. It's completely fine.
Yeah, this isn't a crisis. Like, we're going to be okay. And sometimes you have to you have to say that to yourself because we get and a lot of people get stuck in this, like, I got to rush to this. I got to do this. This is this. And you can live every single day like that. And it will wear on your health. I guarantee it.
So with the last thing I wanted to bring up is where does exercise play into this? Exercise is obviously amazing, and I know everyone's going to be different, but you'd say like you have a lot of athletes. Is there a longer recovery period, so to speak, with the a lot of the clients that you have of maybe if they are in a bit more of a stressful time, they could just might need a little bit more recovery, less intensity, less volume in their exercise?
Yes, so absolutely. I am all about meeting your body where it's at, the least effective dose, and the dose makes the poison. Like those are the phrases I'm constantly saying to people to help them understand that you can customize anything to your needs. Like it's, and this is also coming out of the black and white mindset. So first we got to get out of that mindset, and then we have to understand that. Um, 5% is better than 0%, and that's okay. I'm sure it doesn't feel like much to people who are used to going all out and 100% all the time. Meeting your body where it's at, meaning we have to find your threshold of the activity that you can do without feeling like you are either going to go into a flare or it takes you many days to recover. There's a normal, recovery that you might feel a little bit sore, and need to rest. But ultimately, the way I view it is, and I'm not a specialist in exercise, I'm not a personal trainer. This is just something I've learned and I'm passionate about. But um, your exercise and your movement, whatever that looks like, the intensity, frequency, volume, all of that, it should ultimately be, you should feel more energized. You should feel better, a net positive from your routine or what you're currently doing. That's a pretty good sign that your body is able to handle that energy output, the demand, because exercise is a stressor and we want it to be placed in that positive stressor bucket and not the negative stressor bucket. And a lot of times, depending on someone's nutrition and stress and sleep, their training starts to become more of a negative stressor than a positive one because they don't understand the balance as a whole of what they're doing right now. And thankfully it can change and you can change it, which is great. So it might look like, hey, can you just walk, after dinner for 15 minutes? Or can you get out your walking pad and when you watch TV after dinner, can you walk for 10 minutes? And most people are like, yeah, that sounds really easy. Or I've had quite a few clients where they, they're working out at the gym or strength training 5 to 6 days a week. They're not certainly not eating enough to meet that demand. And I have to tell them, hey, we're going to pull back on this is too much right now. And we can see that through how your body is communicating. You are fatigued. You can't recover. Your sleep is terrible. You're hungry all the time. These are all signs. Your period's irregular. These are all signs that there's a mismatch. So sure enough, they pull back on their strength training. They focus a little more on recovery. And what do we see? Like their progress starts exploding, and they start feeling better and they start enjoying working out more and more and more. So yes, a lot of educating around that topic of movement, depending on what someone's doing and the goals they have. If they're in the military or they're an athlete, there's going to obviously be maybe some more dialing in and more emphasis on that. But if you're just average person wanting to be fit and functional, it may look different than you thought. And that's something that when I learned that like you can do less and get better results, it was extremely liberating. I was like, oh my gosh, like I only have to strength train 2 to 3 times a week to like maintain like a healthy physique. This is perfect for my lifestyle. I can do that.
No, I love that idea of like what's the minimum effective volume or the minimum effective dose in order to get still wonderful adaptations. And one thing I tell a lot of my clients too, it's this kind of like um, make a difference today. So make every mile count, make every rep count, but don't do so much that you can't come back again tomorrow or that you wipe yourself out and you immediately have to go home and you get sick or you go to sleep. Like
Right.
do enough, but like you want to be able to feel awesome throughout the day.
Yeah, because
It's
that's the
like,
point, right? Like the
yeah.
point is not to tear your body down so hard it can't recover and repair. And that's also something too that with autoimmunity, when there's systemic inflammation and maybe lower antioxidant reserves, like it can be a lot harder to recover. And I have people tell me online, they're like, what do I do? I can't even go for a walk without feeling like more joint pain and more whatever. And the answer is not always so simple. It's like, well, what's your nutrition? Are you eating enough? Are you getting enough antioxidants? Maybe we have to support the inflammation piece before you increase your exercise because that's the tricky part too, and I'm sure you know this very well. Exercise, it mitigates inflammation and helps the immune system when done properly in the context of your health and what you have going on. So we want to find that sweet spot, that it's a tool to help mitigate your autoimmunity, not send you into a flare. And that is different for everyone, but you can move the needle to, over time increase that threshold and train harder. But we have to, like I said earlier, like we have to have those foundations set, and we have to have that routine established first, usually.
Alicia, this has been brilliant. Where can people find you? I want to link it down in the description.
Yeah, easiest place is Instagram. So at Alicia_thyroid_RD. So that's where I have a lot of my other, you can reach out to me personally on there, different courses and things like that. So that's the best place.
This has been awesome. I definitely learned a lot today. So thank you
Great.
for coming on and chatting with me. And I'm sure the audience will also take a lot away from this. So thank you for coming on today.
Thank you for having me. It's been a pleasure.